What's up, man?
All good, Vin. Just thinking about what the next episode should be about. Well, PRP.
That's cool.
Platelet-rich plasma, better known as PRP, is one of the hottest topics in cosmetic medicine today. In this episode, we're going to learn all about it.
Without the express consent of mall management. I'm so sorry. Sir.
Okay, that's fine. Thank you.
You have a blessed and happy day.
You too.
Right,
Happy
thank you
Easter.
very much.
We just got busted by the man. Hey guys, I'm Dr. Mudgil. I'm a dermatologist and dermatopathologist based in New York City and Long Island. I'm a New York Times super doctor and a Castle Connolly top doctor. I practice cosmetic, medical, and surgical dermatology. Welcome to the Dr. Mudgil Show. I'm sure many of you have heard of platelet-rich plasma, or PRP, and all of its wonderful uses. But the question is, what is PRP? Platelet-rich plasma is known as PRP. The way we get PRP is we draw our patient's blood and we put it into one of these test tubes. Once they're in one of these test tubes, we place the blood into a centrifuge and we spin it. Once the tube has been removed from the centrifuge, you basically have the blood broken down into its various components. At the bottom of the tube are the cells, red blood cells, white blood cells, etc. In the middle portion here is stuff that makes a clot, fibrin, a bunch of other proteins, and this is actually what a clot is. Above that is the plasma. Now the plasma is essentially broken into two components. Platelet-poor plasma, which is the top portion of this tube, and platelet-rich plasma, which is on the bottom portion of this fluid. Platelet-rich plasma is what we refer to as liquid gold. It has tons of growth factors and nutrients that help with wound healing. For our purposes, they help us with a lot of cosmetic stuff, which I'm going to get to in a minute. So once we have this tube, the first step is we extract the platelet-poor plasma out. And then we're basically able to harvest the platelet-rich plasma. Now that's what dermatologists use to treat hair loss, because platelet-rich plasma has lots of growth factors and proteins and nutrients which stimulate the stem cells in our hair follicle to help us grow healthier, thicker, more voluminous hair. We can also use platelet-rich plasma in combination with laser procedures. So we use it in combination with fractional laser resurfacing or other laser procedures when we treat acne scars or surgical scars or traumatic scars. Now what the platelet-rich plasma does in this setting, the laser causes little microscopic holes to be made in the collagen. When we infuse the platelet-rich plasma on top of the laser, or on top of the effects of the laser rather, it helps to stimulate our collagen to grow in a healthier way, which makes a scar look better. Many of you may have heard of the vampire facial made famous by Kim Kardashian. That uses the combination of microneedling with platelet-rich plasma. Now, all of these procedures essentially are doing very similar things. We're using proteins, growth factors from someone's own body to stimulate the collagen and the cells in their body to perform in an enhanced way. There's nothing more natural than using PRP. PRP comes from me and I inject it back into myself. There's no way that I can be allergic to it or have an adverse reaction to it. It basically is all good. It only can benefit us. So now it's being employed in tons of different dermatologic and plastic surgical procedures because it's a way to give our patients a better outcome without increasing any risk. So now that you know all about PRP, when we come back from the break, you're gonna see PRP in action. So earlier in the episode, we discussed how platelet-rich plasma works and the ways that I use it in my practice. But let's get into some of the specifics. So for our patients with hair loss, both men and women who are experiencing thinning of their scalp hair, we have a treatment protocol which requires our patients to come once every 4 weeks for the first 3 months. And then after that, we perform platelet-rich plasma injections every 3 to 4 months as maintenance. Our patients love this procedure because they notice thickening of their hair. For our patients that have thinning along their part lines, they're noticing that thinning narrowing and more fullness in that area. It's a really, really easy procedure, which our patients get a lot of satisfaction and value out of. The treatments themselves, or the appointments themselves, are about 30 to 40 minutes long. It actually takes 30 minutes or so to prepare the platelet-rich plasma. From drawing the blood, to spinning it down, to extracting the platelet-rich plasma, that takes about 25 minutes or so. The injections themselves, believe it or not, only take 5 or 6 minutes. We use a vibrating device when we're injecting the platelet-rich plasma to really minimize any discomfort that our patients experience. The procedure itself is very well tolerated, so if you're afraid of injections, we use a very fine needle with the vibrating device, which minimizes any pain and makes it really, really easy to get through the procedure itself. For our patients with acne scars or other scars like traumatic scars, where we combine the use of fractional laser technology with platelet-rich plasma, those appointments are about 45 minutes long or so. The laser component of the appointment takes about 30 minutes. When we treat a full face for acne scars, it takes about half an hour. Infusing the platelet-rich plasma takes about 10 or 15 minutes. To infuse the platelet-rich plasma below the surface of the skin, we use some really cool technology. We have gold-plated microchannels, which enable us to deliver the platelet-rich plasma just below the surface of the skin, where the collagen lives. The laser disrupts the collagen. That's how it treats a scar. With the addition of platelet-rich plasma, we add nutrients and growth factors, which allow collagen to form more normally and more healthy. So here we have the Aqua Gold Fine Touch, which uses Aqua Gold microchannel technology. Let me show you what this is all about. So we place the platelet-rich plasma in this receptacle here. In the cap are gold-plated microchannels. The microchannels are about the diameter of a hair, so they're super tiny, but they're hollow. So when we place the microchannels on the surface of the skin, we're able to deliver platelet-rich plasma directly into the skin, right where it needs to be, which is where the collagen's living. So this has really enabled us to deliver platelet-rich plasma in essentially a pain-free way, but more importantly, it's super, super effective and gets the platelet-rich plasma exactly where it needs to be to exert its maximal effect. So now you have some insight into how an actual PRP appointment works. When we come back from the break, we're going to visit some of my colleagues to find out how they use PRP in their practices.
A real shift in mindset for me has been viewing change as an opportunity rather than something that's scary. You know, when I started my office years ago, about 10 years ago, anytime there was a slight change, whether it was in personnel or someone on the front desk, a nurse, a new doctor, a doctor leaving, it's a scary thing, when you think about it, because it's a small office. There's, each additional body that's in there or not in there, it sets up a chain reaction of events and emotions. And that change can potentially be scary. Is the new person going to fit in with everyone else, or is the person leaving going to increase the load on the other folks that are staying behind? And just going through all those thoughts, it can, your mind starts racing and it can be pretty scary. But as the years have gone on, I've really viewed those types of changes in my world as real potential opportunities to either right things that were wrong or add new positive energy into the workflow of the office or the relationship or whatever it is. So to me, the mindset shift of change being something that's potentially positive and embracing change has been something that I've found really personally helpful. Because, after all, who wants to kind of view a change as being scary? It's only going to kind of set you up for failure. That negative mindset is going to self-perpetuate and create a negative situation. Whereas if you have a positive spin on change and really kind of view it as something that can potentially enhance your world, enhance the way things work in your world, make things function better, then change is a beautiful thing. So let's embrace change. Let's view change positively, and let's get it. All right, guys, so as promised, we're gonna go visit with some of my colleagues who are performing PRP around town. First stop is the director of the Dermatology and Laser Group, my buddy Arash Akavan, Dr. Arash Akavan. After that, we're going to be visiting with Dr. Robin Blum, who's the medical director of Central Park South Dermatology. And last, we're going to visit my buddy, a plastic surgeon, Dr. Dilip Manani. Let's roll. My daughter's texting me right now. I'm negotiating mommy-daughter battles right now. Your wife and your kids are always your boss. It's interesting, we all started doing PRP around the same time. Basically the same technique, but it's pretty cool, like when you talk to each other. We all kind of do it the same way now, but it's through like picking each other's brains to figure out what the best way to do it is, which is like, that's why it's important to have colleagues, because it just makes us all better doctors, you know, kind of learning what each of us are doing and the best way to do it. And we're all very open with each other and share those best techniques with each other. Because, you know, at the end of the day, the goal is to deliver the best quality care for all of our patients in like the most pain-free manner. This is all spontaneous. You ready? Good? Okay. Hey guys, I'm here to see the boss. So I couldn't be more excited to be here with Dr. Arash Akhavan, who's the founder and medical director of the Dermatology and Laser Group, which is known as one of the premier cosmetic destinations for our patients seeking anything cosmetic in New York City. So we were able to take the trip uptown, grab you for a few minutes in the middle of your busy day. I believe you're about to perform a PRP procedure, which is very opportune because we're here to talk to you all about it.
So. Yeah, no, we have a few minutes while this patient's blood spins down, and
perfect.
I'm really happy to have you guys here. Thank you for making the trip. Yeah, so PRP, I think we both picked it up in our practices about the same time.
Yeah.
Use it like most dermatologists do for a variety of reasons. I'm really excited about some of the hair growth we get with the device. We use it for hair thinning in both men and women pretty successfully. Pretty easy, quick treatment, nothing much in terms of adverse events. It's, after all, your own blood being injected back into you. And that's something patients have been very happy with. We use it quite a bit for facial rejuvenation as well. Some key areas that we use it for are the under eye. I find it really helpful for. I inject it there with a standard needle or cannula, the same way we'd inject filler, but we're not injecting filler and we're still getting a lot of improvement.
So you're doing that for hollowing under the eyes?
Hollowing under the eyes, discoloration under the eyes, for fine lines around the eyes, and it's been very impressive there. We've been using it combined with filler for facial rejuvenation in other areas like the cheeks augmentation, jawline augmentation. The idea there being that you're getting a little bit of sort of native collagen, some biostimulatory activity with these products, so you're getting some native collagen generation as well. I think it gives the skin a great glow and a better texture in addition to the volume from the filler, so I love that combination.
One of the things I actually learned from you, and we were talking about this on the ride up, is using the Aqua Gold technology. Is that how you infuse the platelet-rich plasma for doing filler, or do you inject it directly into the skin?
With filler, I actually combine the filler product and the PRP together and then inject it directly into the skin. But the Aqua Gold I love as well. So we use that in combination with other rejuvenation procedures like chemical peels, microneedling, laser procedures, and right then and there, as soon as that procedure is done, we'll take the PRP, put it into this device called Aqua Gold that has hollow bore needles that inject the PRP material, or anything you want to inject, about 6 microns deep under the skin. So it's a great way to get the PRP delivered to exactly where you want it to be active.
Yeah, we use it a lot with our fractional laser procedures, and one of the amazing things I've found is even our patients' pore size is decreasing. You know, they really have a good pop, you know, quote unquote pop in their skin a few weeks after doing the procedure. So it's been huge, and I thank you for that.
Yeah, I know.
For sharing that with me.
That's what our field is about. I think the two of us kind of throw ideas at each other all the time.
Yeah.
It's the only way you can grow, really.
Yeah, exactly. That's really, we're having that same exact conversation in the car right on the way up.
Yeah.
So, Arash, I can't thank you enough, man. I'm going to let you get back to your patients who are
so
waiting
much.
for you. And I'm sure we'll have you on the show again.
Pleasure.
All right,
Thanks.
man. All right. Okay, it's 200 Central Park South. So we made it, we found it. Central Park South Dermatology, right here. Central Park is right over here. The famous Robin Blum. Let's go.
Wait, let me put my phone down. Like, I just took my white coat off. It's got blood on it.
Are you guys done?
Yeah.
You go, I'm not sure.
Dr. Blum?
Makeup on your shirt. Right here.
Just edit that out.
Yeah.
This is nice.
You've been here, haven't you?
I've never been here before.
Yeah, you have.
No, I've never been here before.
I think years ago
I
when I
swear.
first. Really? You've never been to my
I've
office?
never been here.
That's crazy.
It's so nice.
You have the best spot. Right in the corner.
I like it. I'm very happy with my space.
I know. I'm a little jelly. So I couldn't be more excited to be sitting here with my old friend who is the medical director and founder of Central Park South Dermatology, correct?
Correct?
And we're talking about PRP. So this episode's all about PRP. And what I'm doing is I'm going around to various offices with leaders in the field to find out how they've incorporated PRP into their practice and how it's changed the way they practice. So maybe you could just give us your 2 cents about how you use PRP.
Yeah, so PRP has really been a great addition to my practice. We really primarily use it as an adjunct to people with hair loss, both men and women who are suffering from a little bit of hair loss. We can easily add it. It's done in the office. It's an easy procedure, minimal downtime. Come in and leave out the office and go to work, no problem.
Yeah, it's
been
great. Our patients love it too. How exactly do you do it?
So our patients come in, the first thing we do is we draw their blood in the office. When we centrifuge their blood, we put it in the spinner, it spins itself down, we take pictures, then have them sit down, and then we inject into their scalp, into the areas of hair loss.
And how frequently do they have to come in?
So we do it once a month for 4 months, and then after that, every 6 months.
Okay. Yes, it's interesting because everyone has like a different paradigm. So for us, we do it once a month for 3 months, and then every 3 or 4 months is maintenance. But I think at the end result is, I mean, I know for our patients, they're super, super satisfied and psyched, and everyone gets some sort of result. I mean, it's variable.
Yeah, it's been a great experience so far for patients. I mean, the problem is it takes a few months till they see their results, so they get a little bit impatient. It's not uncostly for them, but once they start to see their results, they're super happy. It's really such an easy procedure to do, and the results have been amazing.
Yeah, I couldn't agree more. I mean, our patients love it too. Do you use it for anything else?
Yeah, so we can also use it for skin benefits. We'll use it for anti-aging, for scarring, for pore minimization, and just to overall improve complexion. And patients have been happy with that as well.
So do you use it in combination with laser or just as a primary modality?
So we've been doing it mixing in with our fractionated handpiece, so combining it afterwards.
Cool, that's what we do.
Ah, see, I learned from the best.
Yes, so I mean, one of the things we actually did talk about while we were driving up here is that how all of us, we all, yourself, Dr. Ackerman and myself, we all kind of came up together in dermatology, and we're also very, we share whatever secrets we learned by practicing. So I thank you for teaching me the things that you've learned, and Raj taught us both lots of stuff.
Well, I wouldn't be here without you, so I
it's a
thank
team.
you as well.
Yeah,
Yes,
medicine's
teamwork.
a team. So thanks, Robin. Thank you so much for taking a few minutes out of your busy day. I know
I'm honored to be here with you, so thank you for having me.
You have a busy, you're about to do a laser procedure, so we gotta let you go take care of your patients.
Thank
and
you.
We'll have you back on the show soon.
I'd love to.
Thanks, Robin. Bye. So we just wrapped up with Dr. Ackerman and Dr. Blum, who are both dermatologists like me, and we talked about the way they use PRP in their practice. It was great. It was great seeing them because I love them. They're both very close friends of mine, but it was also great to hear how they use PRP in their clinical practice. So now we're about to see Dr. Dilip Badani, who's a facial plastic surgeon, and I'm curious to find out if he uses PRP in a way that's different than the way that we use it. So let's go and find out. So we made it. We're here. We're on 5th Avenue outside of the offices of world-famous plastic surgeon Dr. Dilip Badani. We're going to find out if the way he uses PRP is any different from the way that us dermatologists use it. Let's go hear what he has to say. So I am blessed to be here with world-famous plastic surgeon, facial plastic surgeon, Dr. Dilip Badani, who is, I would say you've probably done more facelifts than almost anybody, just based on our conversations. So this episode, Dilip, is all about PRP, and I spoke to a couple of dermatologists who use PRP in a similar way that I use it. We use it to treat hair loss in combination with lasers, with fractional laser treatments. But I'm curious to know how a plastic surgeon who's really just getting all in there, all up in the face and, fixing things from deep down, how do you use PRP? What's the biggest ways you use it in your practice?
We've been doing some fun things with it. As obviously with the resurfacing lasers, we've been combining it almost as like a PRP facial. But not only do we put it superficially, we also inject it, especially everywhere we inject the fillers. We've been injecting the PRP in those areas too. I've been mixing the PRP with my facial fat transfers. There's some studies that show it prolongs the longevity of that. So that's also been a great addition to what we do. And if I have patients that have poor healing after facelifts, whether we have smokers or diabetics, I actually inject the PRP into those areas, and the healing is phenomenal.
I saw on your Instagram story today that you did carbon dioxide laser, which is a completely ablative resurfacing with PRP. So
Yes.
do you just sprinkle the PRP on after you do the ablative
So once again, we
resurfacing?
did both. I hit them nicely with the CO2 resurfacing. It's ablative, but it's fractionated ablative.
Okay.
So it's not
Gotcha.
a full resurfacing. It's a fractionated ablative procedure. I do two things. I inject it also. We inject all over the superficial injections, all over the subdermis, in the face, around the mouth, especially under the eyes, and the forehead.
Well, I think that pretty much sums it up. So I think we have a pretty good understanding of how a plastic surgeon uses PRP. And I know you're super busy. I mean, you're in and out of the OR. You have a day full of patients. So I really appreciate you taking a few minutes out of your day to explain to my viewers how a plastic surgeon uses PRP. So this is great, man.
No, thanks for having us.
Thanks so much.
Thank you so much for watching this episode. If you're in the New York City area and would like to see me as a patient, you can call either one of my offices to schedule a consultation. You can also find me on YouTube, Instagram, Facebook, and Twitter. We'll see you next time.